We discuss and talk. Okay. Tengok each other ke?
Ya, kamera pun boleh.
Tak nak.
Okey, boleh start. Assalamualaikum dan salam sejahtera. Saya Dr. Siti Salimah binti Muhammad.
Saya Dr. Syamil. Kami dari klinik Pergigian Section 19 Shah Alam.
Sebelum pandemik COVID, kami tidak menggunakan sistem temu janji untuk pesakit luar. Kami hanya menggunakan sistem walk-in. Pasien yang datang kami akan terima teruslah, tak memerlukan temu janji. Tapi apabila pandemik COVID berlaku, iaitu awal tahun hujung tahun 2019, kami mengalami masalah dengan kehadiran pesakit walk-in ini sebab kami perlu menghadkan jumlah pesakit. Oh no! Boleh detail buat tulisan lagi tak?
Okey, selamat petang. Saya Dr. Hasginda, Ketua Klinik Kesihatan Puchong ya. Jadi sebagai satu-satunya klinik ya, di kawasan yang sangat padat ini, salah satu cabaran kita yang utama adalah kedatangan pesakit yang sangat ramai. Kita punya kedatangan dulu kalau ikutkan era daripada zaman sebelum pandemik COVID mencecah sampai 3,000 orang sehari, yang membuatkan klinik kita pernah heboh suatu masa dahulu sebagai klinik start waktu subuh katanya, iaitu seawal pukul 4 pagi ramai pesakit-pesakit kita telah pun beratur di luar pagar untuk memastikan mereka mendapat perkhidmatan yang cekap.
Sebenarnya mula-mula kita agak macam
We thought it must be very difficult, tapi bila dah belajar macam it take time 1 or 2 days only, but bila dah memang bekerja dengan ni, also it's like easy, it's very easy.
Kadang-kadang dia tak boleh nak buat, anak dia tak ada. Tetapi QueueMed ni dia bukan sahaja untuk orang muda boleh guna. Kalau dia sendiri tak ada handphone, kita sebagai in charge QueueMed, kita ajar mereka. Kita boleh gunakan daripada aplikasi tu untuk kita buat pada mereka yang tidak ada telefon. Jadi apabila ada kemudahan seperti ini yang diperkenalkan oleh pihak QueueMed, senang untuk kita membantu pesakit lah. Okay? Dan juga lama-kelamaan kita lihat sistem QueueMed ni banyak yang boleh menerima dan sangat senang.
We are part of the KKM before this, so we understand how tough the challenge that KKM is facing. And myself, the very first reason that I started this company is because my daughter having some medical conditions that I need to seek a lot of follow-up, and I face a lot of difficulty. So we need a place, we need a technology, we need a solution to help them to maintain their social distancing, to help them to get their medical attention more easily. And that's why the KKM come to us. When the KKM come to us, we are very excited, and we are very proud that we can have this opportunity to help the nations.
As we can imagine, right, we always wanted to be like the advanced countries where they have good booking system and even queuing system in their clinics. Especially like we can take example of United States of America, they have a very good booking system. So every time the patient go to the clinic, they don't have to wait in the clinic. So or they have a very minimal waiting times. I think this is what we dream for. So I think in the 1 year durations of we helping the Klinik Kesihatan in different states, I think we are able to achieving that by now.
We are spearheading the project for the whole population of Malaysia. We're trying to cut down the waiting time for them in the hospital. As we all know that each one of us had the experience of visiting a hospital one way or another. So when we were in face of COVID-19, we've been tasked to set up the system, which is the appointment system, not only to cut down the waiting time, but also to ensure that the social distance is being adhered to.
So involving in the medical line, I can say that we have to understand a lot of their process in the health clinic, a lot of medical terms and requirements and all the things involved, because when we are building the appointment system program, we are also catered the services to the clinic's requirement.
We didn't implement the 180 clinic Kesihatan in single night. So we do it in different phases. So the first phase actually we implemented in 4 pilot clinic Kesihatan, which is located in Klang Valley in Kuala Lumpur. And with this experience, we actually do a lot of enhancements and we do a lot of new features to cater for the clinic Kesihatan flow, to cater for the patient's flow. And from there, we are able to scale this module or these solutions to other clinic Kesihatan. Because we are a tech company at the end, we are a tech company, our solution is very scalable. So you can see that we have implemented our solutions to other states like Terengganu, even Sabah. How we do it in a remote teaching, and our solution is a cloud-based. So we also make it very user-friendly so that other people also very easily get on hand on our solutions.
Prior to the pandemic, the biggest challenge was to ask the hospital patient to adapt to the new appointment system that we have set up for them. They are required to make an appointment before coming to the vicinity. By doing that, we were able to cut down the queue time for them, and the pandemic has actually accelerated the whole process for us, whereby they are being used to scanning the QR code and making an appointment with their mobile phones.
I believe in 5 years' time, Malaysia healthcare system will improve towards more patients' engagement, and we can use the technology to reduce a lot of the repetitive work. Also, apart from that, we are also trying to help the KKM to come up with a solution so the patient can even enjoy the healthcare at home.